Now that you've determined your individual dose, let's discuss the proper technique needed for self-administration. Before we do that, let's discuss the steps and the supplies that you'll need. So first, start by washing your hands, and if you can't wash your hands, hand sanitizer will do. Also have ready your sharps container, alcohol swabs, the syringes, and your vial of testosterone. First, lay everything out on the table before drawing your medication. When injecting testosterone, we recommend using a smaller 27 gauge insulin needle that is a 1/2 inch long to both draw the medication and to inject it. Because testosterone is oil-based, this can take a few extra seconds. To get started, remove the lid on the testosterone vial and wipe it down with an alcohol swab. Ensure all the air bubbles out of your injection by flicking the syringe and pressing the plunger until a small amount of testosterone comes out. Starting with the deltoid, thoroughly cleanse the area with an alcohol swab and give it about 10 seconds to dry. Next, inject the deltoid with the needle, ensuring it goes all the way into the muscle. Press on the plunger until all of the testosterone is injected. Lastly, remove the needle from the deltoid and properly recap the needle.
The next injection we'll be discussing is the ventral glute. The muscle injected here is the gluteus medius. To find this, as a clinician, we look for the greater trochanter of the hip and the anterior iliac crest, which is the hip bone. Now, as a patient, I find the best way to do this is to push out your hip to the side. There, you can feel the muscle that's right under the side of the hip. That's where he'll be injecting. Now we can clean the area with the alcohol swab. When he's cleaning the area, he's starting in the middle and working his way out. Next, uncap the needle. And coming in at a 90-degree angle, he's going to puncture the skin and go all the way into the muscle. Once the needle's all the way in, he'll slowly push all of the contents into the muscle. Once all of the fluid is injected, he'll pull it out and properly recap it.
To do this, put the cap on the edge of a hard surface. Put the needle in the cap and swoop up without holding the cap. Once it is on, you can press down and ensure it is closed. After the cap is properly placed on the needle, dispose of the syringe in the sharps container. Once your sharps container is full, refer to your local laws on proper disposal. If you have any questions about any of this process, please reach out to your patient care coordinator.